Connective tissue diseases in general are not very common, especially of the skin. And even though a lot of our earlier work has focused on the most common toxicities to really provide clinicians with the best kind of top overview of how does one approach diagnosing skin toxicities, we do also want to know, well, what happens with the rare ones. And we do indeed see that connective tissue diseases can present in the immunotherapy setting. But the outcomes of patients who develop these are not any worse than people who don't develop these cutaneous connective tissue diseases. That really was the main takeaway from that study. In general, connective tissue diseases are not that easy to treat, right? Lupus, be it cutaneous lupus or systemic lupus, often does require lifelong management because it is a chronic disease. But what was most important is that in the immunotherapy setting, a lot of these toxicities may not be permanent. In that, if you can get the patient treated past the acute flare, often their condition may tend to subside with time, especially when the immunotherapy is no longer active. So because most of these cancer patients, they either receive a year or up to 2 years of treatment, and hopefully eventually, if their cancer is under full control, they no longer need to receive the immunotherapy. And then the hope is that the toxicities that may have manifested in the setting of immunotherapy will also start to wean away. And sometimes that happens, sometimes it doesn't. But what was reassuring about the cutaneous connective tissue disease story was that the presence of this connective tissue disease, even though it was seen in the immunotherapy setting, did not negatively impact the outcomes against the cancer.